Hi, and welcome to the show. Subscribe at kevinandme.com/podcast. Today, we welcome back Corinne Rao. She's an internal medicine physician, and her latest article is The Faustian Bargain of Modern Medicine. Corinne, welcome back to the show.
Thank you for having me back, Kevin.
All right, so tell us what your latest article is about.
So, my latest article is basically about physicians being employed. There are figures that are showing us that over the last few years, especially at the start of the COVID pandemic and after, that more and more physicians are becoming employed by hospitals, health systems, and corporate entities. So that number has become somewhere like 75 to 77%, depending on where you're looking at. And those are the latest numbers. This is a huge jump from before, where there were a lot more independent physicians. There were physician groups that were owned by physicians and operated and managed. And it's just something that I've been thinking about and I've been seeing whenever I talk to a lot of physicians during going to different facilities and meeting several people. And it led me to wonder, I think everybody kind of feels it's not a good thing, but I started thinking, is this like the story of Dr. Faustus, who basically made a deal with the devil? It sounds a little dramatic, but the bottom line is, are we making a bargain in order to be employed, and what are we giving up? So that's basically what the article is exploring.
All right, and when you say that something like in the high 70% of physicians are being employed, in most cases, they're being employed by academic medical centers, hospitals, large healthcare systems. Why do you think that number has been rising over the last few decades?
I think, Kevin, the landscape is shifting. Things are becoming more complex for all kinds of reasons. And, that includes legal, regulatory, financial, just all kinds of reasons. And it's become really difficult for physicians to maintain an independent practice because they're bearing quite a bit of burden to meet all these regulatory requirements to start with. And I think they make the jump because they feel that that's one way for them to keep practicing and stay in the game. So I think it's a whole bunch of factors that are contributing. And it's been over time. I don't think it's something that just happened overnight, but this is kind of the trend that we're seeing.
So you framed this as a Faustian bargain. So why do you think that is for those physicians who proverbially make that deal, perhaps for short-term gain, but what are some of the long-term consequences?
There's a lot of consequences, and that's the reason I compared it to being a Faustian bargain, because I have to feel that it leads to loss of autonomy. And there are two competing entities here. There's the physician, and as you know, being a fellow physician, that our responsibility and our job really, our training consists of it's for the patient, what's in their best interest. And corporate entities, health systems, they have a fiduciary responsibility to their shareholders, to that company. And I don't think you can really combine the two because there's going to be a diverging interest there. And what that leads to is when we sign on as being employed, basically we're giving up a lot of our autonomy. Our autonomy in terms of time, the time we may spend with patients, the time we have to do all of our responsibilities. And it's just really hard for me to see how that leads to better patient care. So that's why I was comparing it, because we have to give up something. And I think what we're giving up here is our autonomy.
And when we give up that autonomy, when you talk to these physicians in these conferences who are employed in general, or are they happy with the arrangement? What is some of the feedback that they're giving you?
So it's all over the place because in many cases, when we're in training or we're coming out of training, we don't have a lot of experience in thinking outside the box when it comes to our own careers. They don't really train us or give us much information. So physicians tend to think only in terms of they have to sign an employment agreement, and that's going to give them a somewhat stable salary and benefits. And keep in mind that they're coming out with a lot of debt in some cases or having spent a lot of money to get that education and definitely a lot of time. So there's that pressure. And so this seems to be like a lot of them think that's the only path. Many of them don't seem to realize that there are other ways. But I think more and more are realizing there are other ways to practice medicine on your own terms. It's just going to be what can you do to reach that point and what's going to work for you because everybody's situation is different. As far as feeling happy with their choices, I'm seeing a lot of dissatisfaction because at first you have what you call the honeymoon period, everything is
Yeah.
good, you're being welcomed, and then over time it just leads to you just there's more and more being asked of you, and there isn't more and more time. So something has to give. And there's fatigue, there's burnout, and there's just a lot of dissatisfaction.
Can there be a scenario when a physician is working in an employed model yet still maintain that autonomy? Is that even a possibility, or are those just two competing tensions that can never get along?
It's a tough question because I think it's two competing entities. And it's hard to correlate both at the end of the day because we just don't have enough hours in the day to do everything that we're asked to do, as well as do everything that's best for our patients. So I think there's two competing entities. I'm just going to add here, Kevin, that I'm not by any means suggesting that every employer or every hospital is not good. That's not at all what I'm suggesting, or that there aren't physicians who are pretty happy with where they're at. But the general feeling is that there's a lot they're giving up by signing those contracts. And you can see that in just the way these contracts are structured or are changing. Because I've been here for a long time and I've been on both sides. I've been employed, and for the last few years, I've been by myself, independent. And for me, anyway, I see now that the independent side is better. There's risk involved to it, obviously, but I think there's risk involved in anything we do. So,
So let's talk about some of those risks because, as you mentioned, almost 80% of physicians are an employed model, and it's becoming increasingly difficult to become an independent practicing physicians because you have to compete with bigger and bigger hospital systems, academic medical centers, and whatnot. So, talk about some of the challenges. How realistic is it for physicians to choose an independent model when there's just so many large entities that they would have to compete against?
so we have to step back and look at what are the options. And I'm happy to say that I do also meet many physicians that are doing very many different things. So it doesn't have to be one or the other. You can be exploring a lot of other options that would allow you to be independent. So maybe you can't just open your own practice and be busy from day one, but could you start looking at a somewhat hybrid practice? Could you start doing some shifts for locums? What can you do? There's so many options. There are physicians that are doing all kinds of things. They're in non-clinical scenarios. They're exploring, those options, and there's a whole spectrum of those, from chart reviews done remotely to being a medical expert witness to being in pharma where they have physicians that are, helping them. So there's a lot of options. I don't think there isn't. And it just depends what you want to do. What are you looking at? So yes, if you're looking at a traditional practice, it's challenging because there's things to deal with like insurances, regulations, so many things. So your overhead is going to be high. That would be challenging, no doubt. But there are so many other ways to explore being independent.
Now, like you mentioned earlier, a lot of newly graduated physicians, they're graduating with hundreds of thousands of dollars in debt. Do you think that they're willing to take some of that uncertainty, some of the risk that you mentioned, whether it's a hybrid practice or independent practice, when they have so much in debt?
It's very difficult, no doubt. And I don't say this lightly when I say that it's a Faustian bargain. But I think that it's okay for them to jump into their first job, but you also want to be open to looking around you and learning of other possibilities. You just can't keep the blinkers on and just go down one path. So it's definitely challenging, but I've actually seen a couple of younger physicians that are right out of residency that are doing that, and it's been very encouraging to actually talk to them and see that the path that they're taking is not the traditional one.
As you mentioned earlier, a lot of physicians in training, they typically train in academic medical centers, so they're only exposed to one style of medicine. It's not like private practice physicians or independent physicians goes in and talks with them. So how can they get exposed to some of these different models of practice and maybe consider some options that they ordinarily wouldn't have thought of?
I think they just have to network with other physicians. They have to have mentors that are attending physicians at different stages of their career. I myself have had the opportunity to have medical students and residents, even as an independent contractor at a couple of my facilities. And if they ask me stuff, or I try to talk to them about those things too. Because to be honest, they can learn about congestive heart failure and hypertension from many of their regular didactics, but nobody's going to tell them what to look for in a contract or what to look for when you're graduating. So there's many ways for them. I think they have to take advantage of the mentors that are around them, and I think they have to stay engaged and look around and just explore or just look at what are the other possibilities.
What do you think is going to happen going forward? Over the last decade, the number of employed physicians is almost reaching 80%. You said it's in the high 70s. Do you see that trend continuing? And if so, what does that mean for those who want to practice independently?
What's happening is that there is dissatisfaction growing with the choices that we have made. So eventually, I think the pendulum is going to start swinging back. Whether it's going to happen in our lifetime, I don't know. But even just to see the needle moving would be encouraging. And I think we're going to see that. I just don't see it sustainable at the rate it's going. The other side of this, Kevin, is that a lot of physicians with the burnout and everything, a lot of them are retiring early or leaving clinical medicine. So it's actually an important thing to think about when we think about what are the causes of dissatisfaction. And that's why we have to explore these issues. Even though it's so complicated, we have to look at that and see, because it's just going to lead to more people just giving up and quitting. Already the physician workforce is aging. I forget the exact numbers, but there's a large percentage of us that are over the age of 55. So they're not going to work forever. So it's just all leading to an unsustainable level where are we going to get the care that we need from a physician? And it's kind of a scary thought. So I hope that the pendulum is going to swing back. How long it's going to take, or it's anybody's guess.
We're talking to Corinne Rao. She's an internal medicine physician. Today's Kevin MD article is The Faustian Bargain of Modern Medicine. Corinne, let's end with some take home messages that you want to leave with the Kevin MD audience.
Kevin, my take home message is that in this changing landscape, just think about what you're signing on with and decide what's important for you. And in the end, I think, is it possible to avoid a Faustian bargain? Yes, it is. So I hope that each one of us can think what's important to us and kind of go with that. So that would be my take home message.
Corinne, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you for having me, Kevin. It's been a pleasure.